Does Medicare cover caregivers? Once a person has Medicare and gets through the stress of deciding on original Medicare versus an Advantage plan and all the other stuff that you need to know about your Medicare choices, they often start to wonder about specific situations and how they may be covered by Medicare. Now, one topic that is common is that of caregivers. If I need a caregiver, does Medicare pay for it? Now, the general answer to that question is to say that under some specific circumstances, yes, but not always. And there is a lot of gray area that you need to understand, which is what I will cover in this video. Hi, I'm Matthew Clausen with MedigapSeminars.org. Welcome to my first video in our series titled, What Does Medicare Cover? This series will include videos detailing what you need to know about Medicare coverage once you have Medicare. This series will include videos about diabetic care, surgeries, cancer screening, hospice care, and much, much more. Please subscribe and click the bell icon to be alerted when another video in this series is published. This is information that you will want to know before you're in a situation where you'll need it. Now, there's a lot of information in this video. You may want to take notes. I've also linked some Medicare brochures on this subject in the show notes below. So let's get started with Does Medicare cover caregivers? In Medicare, the use of caregivers when they come to your home falls under the category of home health care. The term caregiver is very general, if not vague. It encompasses several specific types of care, not all of which are covered by Medicare. There's companion services that offer company and activity to stave off depression and loneliness. There are personal care services that help with activities of daily living like dressing, eating, bathing, and so on. There are homemaker services that help with housekeeping, shopping, meals, and transportation. There's also skilled care provided by a licensed healthcare professional who can help with wound care, occupational, physical, or speech therapy, and medication. That may be covered by Medicare under certain circumstances and very strict limitations. So what does Medicare cover, and how do you get a Medicare-covered caregiver or home health care service? Let's first look at how a person can qualify for a caregiver under Medicare. First, a doctor must certify a person as homebound. What does homebound mean? From Medicare's point of view, a homebound person is someone who has difficulty leaving home without the help of either a person or medical equipment due to a condition that's resulted from illness or injury, or a person whose doctor recommended they not leave the home due to a medical condition. Injury includes surgery. I was once told by a surgeon that a surgery is simply a controlled injury. I can tell you once you've had to recover from a few, that begins to make a lot of sense. And that's an important definition. Medicare's definition of homebound means that attending events like religious services, adult daycare, or doctor's appointments will not disqualify a person from being considered homebound. Then second, the doctor must have a written plan of care for the patient's in-home services. The written plan must include the type of care that you need, the length of time that you will need the caregiver, and how often they visit, along with the doctor's expected results. The goal of this written plan must be to either recover and regain your independence or become more self-sufficient, or to maintain your current level of function and slow down any decline. The agency that provides a home health care caregiver must be certified by Medicare. You can get a list of such agencies in your area off the Medicare.gov website, and your doctor will likely provide you with a list as well. So what kind of services can be provided to you and are covered by Medicare? They can provide part-time skilled nursing care, physical therapy, occupational therapy, speech therapy, which may be required, for example, after a stroke, and part-time home health aide services. Part-time is important. It means less than 8 hours each day and less than 28 hours per week. And there are some exceptions to that rule. The home health caregiver can check your vitals, your blood pressure, your heart rate, etc., check what you're eating, make certain you're taking your prescriptions, check to see if you're in pain, check the safety of your home considering your condition. They help you to physically recover so you can take care of yourself or at least maintain your level of physical health. And they coordinate your care with your doctor and any other healthcare providers. Medicare also provides medical supplies and durable medical equipment. And this can be canes for walking, crutches, a hospital bed, CPAP devices, a commode chair, diabetes equipment, and much more. So how long can you qualify for Medicare-covered home health care and caregiver services? That may depend on whether or not your care is covered by Medicare Part A, inpatient services, or Medicare Part B, outpatient services. Generally, if your home health care is covered under Part B, you can expect up to 21 days of part-time care. The way Medicare covers or pays for home health care Part B is in 30-day units. But you may be able to qualify for more than one 30-day unit of care in some circumstances. And it will require that you see your doctor in a face-to-face visit or evaluation. Please keep in mind that Medicare is not long-term care. So how is a caregiver covered under Part A? Well, if you're in need of home health care services after at least a 3-night stay as a hospital inpatient, your home health care can be covered under Medicare Part A instead of Part B. But you must have spent at least 3 midnights as an inpatient in a medical facility. If your care is covered under Medicare Part A, then Medicare Part A may cover your first 100 days of home care. Regarding billing, your home health care agency will send the bill for your services directly to Medicare. If you have a Medicare supplement, Medicare will notify the supplement of their financial obligations. In addition, the agency must tell you if the services will not be covered by Medicare beforehand. Often they use what's called an ABN form, or Advanced Beneficiary Notice. Now, I have an old video on the ABN form currently, and I will publish a new video on ABN forms with new information in February 2024, so just a week or two from now. The ABN form must be filled in entirely before being presented to you. It must include why they believe the service may not be covered by Medicare and exactly what the service should cost you. Well, not exactly, but a very close estimate, and we'll go over that in the ABN video. Every home healthcare service may have their own Advanced Beneficiary Notice form design, but it's required to have all the information and disclosures of Medicare's standardized form. Now, before we move on, please subscribe to my channel and click the bell icon so that you don't miss out on any of my upcoming videos on Medicare coverage. Okay, let's recap what we've covered so far. To qualify for a home health care caregiver, your doctor must deem you to be homebound. Your doctor must have a written plan with specific instructions for how often you receive care and what results are expected. Your caregiver must be certified by Medicare. Your home health care caregiver must be part-time and temporary. If you need full-time care or 24/7 care, that's not covered under Medicare. Your home health care benefits include necessary medical equipment. If the service providers believe a service may not be covered by Medicare, they must inform you in advance. So what we've covered is for those with original Medicare and hopefully a Medicare supplement. But what about Medicare Advantage plans? Medicare Advantage plans are supposed to cover the same service categories covered by Medicare. But as many of you may already know, with an Advantage plan, insurance companies control your health care and use pre-authorization requirements to limit or deny your coverage. The requirements for the doctor are usually the same as original Medicare, meaning having a written plan and so on. However, your doctor must ask your Medicare Advantage plan insurance company for permission to provide you home health care. The insurance company can deny the request or modify it. That said, according to the Kaiser Family Foundation in 2023, 17% of standard Medicare Advantage plans offer additional home health care benefits in addition to what original Medicare covers. 17%, fewer than 1 out of 5. With special needs plans, it's 31% that offer some additional coverage. But there may be limitations like fewer allowed visits and only up to 4 hours a day. If you happen to have a chronic care special needs plan, you may have additional benefits including non-skilled care and meal plans, etc. Those are chronic care special needs Medicare Advantage plans. The bottom line, Medicare Advantage plans are not standardized, and because the insurance company controls your health care, you may have to fight for your benefits through an appeals process with the insurance company or with Medicare. In an upcoming video on ABN forms, I'm going to go over how to appeal a denial of care. As I mentioned earlier, I have a link in the show notes to a brochure on caregivers provided by Medicare. If you have a topic that you'd like for me to cover, please mention it in the comments below. And if you've had experience with Medicare home health care services, I would love to hear your story. I make these videos for you, and I'll consider any of your ideas. And if you are curious about other topics and you can't wait for my videos, feel free to check out the hundreds of detailed articles that I've written and published on my website, MedigapSeminars.org. They're free, and you can even share them with your friends. My suggestion is to first check the publications under my Resources tab on the website, and if you can't find what you're looking for there, just use the search feature to see if I have an article on the subject. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.